Welcome back. Yes, there's a lot of body pain plaguing Canadians these days. To help us out with that right now, she is a member of the Ontario Chiropractic Association and the Canadian Chiropractic Association as well. Dr. Sasha Hamid joins us one more time. Nice to have you back on a daytime here.
Thank you for having me back, Dylan.
It's good to have you here because there's a lot of people that are maybe doing self-medicating perhaps in a terrible way. And you are trying to give us the reasons why they shouldn't do that.
That's right. So this past October 16th was World Spine Day. And around the world on October 16th, we try to bring light and more awareness to spinal disorders, and musculoskeletal pain being one of the main afflictors of pain in the world, and especially in Canada. So the Canadian Chiropractic Association, along with the provincial associations this past October 16th, put out a report. And the report in itself was called All Pain, No Gain, and it was highlighting the back pain and opioid crisis in Canada.
Okay.
So we know that 90% of Canadians experience daily pain.
90%?
90% from this survey, from this report, yes. And what's happening is 5 million of these Canadians are turning to opioids and painkillers for their first line of approach to treat their pain. So what we're trying to do is, as a result of the opioid crisis, is bring more light and show and make more awareness towards non-pharmacological options that are very effective in treating MSK pain.
Okay, so we'll talk about the options coming up, but when you talk about pain, 90% of us are experiencing pain. What types of pain and what parts of the body?
So the most common one is low back pain.
Okay.
So low back pain, headaches. We're getting knee pain, shoulder pain, neck pain. Those are the most common types of pain that are afflicting Canadians, and most of them are experiencing daily pain.
Okay, so what is bringing on this pain?
So most of this pain is due to
reasons?
lifestyle. So that's one thing that we definitely know, and I mean, we're sitting here today, but most people who are watching us are sitting on their couch, or they're going to watch it later because they're at work sitting in a computer.
Yeah.
So a big sedentary lifestyle. But many people are also reporting that their pain is also affecting them sleeping, lifting, and during physical activity.
Okay, so people are turning to self-medication. So define a self-medication.
So when you have a first line when you're experiencing pain, many people are choosing to take over-the-counter pain medication, or also seeking prescription medication to treat their pain. So they are getting rid of the pain, temporarily masking it, if you will. And what we are trying to do, chiropractors, massage therapists, there are many, and physiotherapists, there are many different ways of actually finding the root cause of much of this musculoskeletal pain, as opposed to going to a masking or a stopgap, which can become dangerous and potentially addictive.
Okay, so if I was to come to you with back pain,
yes,
how do you determine exactly what is causing the pain or how we can fix it?
Absolutely. So people that deal with musculoskeletal pain, and chiropractors are included, we are trained to treat musculoskeletal pain, which means we would assess the person or individual that presents to our clinic and try to find a diagnosis of where the pain is coming from or why they're experiencing these pain. And usually with an accurate diagnosis, we can give treatment options that can help get to the root cause of the problem. And many Canadians report that, nearly all actually, who are seeing chiropractors, that it is helping with their pain, and it's helping co-manage if they are on medications, but also improve their quality of life.
Okay, so why are people self-medicating instead of coming to a professional?
There's a few barriers. One of the big barriers is financial access, or financial barriers. We also have issues with private insurance, but also one of the big ones is people aren't aware of other options as opposed to just medications. That's a big barrier. So we're trying to see more of an integrated approach to treating pain, and chiropractors are part of that solution.
Okay, so how can integrated healthcare teams better manage pain? I mean, I know you've given us some examples. So people come in with this pain, and it's just because you're professional, you know what you're doing, you've studied this for many years, you probably know how to help it out better than just here's some pills.
Absolutely, and one of the big things is giving people the right care for the right condition at the right time.
Yeah, okay, and that's a pretty simple answer, right?
It seems pretty simple, but we do have a large problem, and we're really trying to get the awareness out there and try a more of a, let's find a solution as opposed to the giant patch which has gotten us into trouble.
I'm sorry, did you mention how many Canadians are turning to opioids?
About 5 million people that are looking towards pain medication for that, yes. About 14% are choosing opioids. And the thing that people don't understand with opioids, Ed, is they're used as directed, but they can become addictive. So we have 1 in 8 people who start using opioids who can become addicted. And in Canada, we see nationally on average last year 2,800 deaths that are related to opioids.
Did you just say just within Canada?
Yes.
That's
We're
incredible.
the #2 consumer in the world of opioids.
#2 consumer. Okay.
Yes.
So how can we de-escalate that? How can we stop people from going to this?
So I think by addressing these barriers, which are an issue for people that are looking to try non-pharmacological options, but also more of an integrated approach to managing MSK pain.
Okay, and you were mentioning as well it's because of our lifestyles. I mean, I've got some statistics here about people that 50% of us work in seated environments where they're not moving around a lot. And I know I'm guilty of that as well, working at the radio station. Sometimes I just sit there and hours will actually pass before I've noticed that I've gotten up and moved. And when you do, you're just in complete pain. So what's the best way to attack this? An
active lifestyle. I'm going to keep it simple, just like we tried to with our approach there. But an active lifestyle, trying to make sure that when you're at work, you switch it up, you walk, make your day a little bit harder, park further away, do some activity, and also watch the foods that you eat.
Okay. So just to repeat, not only chiropractors, but who are the best healthcare professionals to help out with pain?
So we're looking at people who deal with musculoskeletal pain. So whether it's chiropractors, physiotherapists, massage therapists, but we also see that yoga, Pilates, physical activity all does help prevent pain, but also address it to help relieve it.
Okay. How much physical activity do you recommend on a daily basis?
Well, I'm going to say minimum 30 minutes a day.
Minimum 30?
Yeah.
What's the maximum? I'm curious about that because I want to know if I'm in there somewhere.
It's every patient's unique. Every person, I should say, is unique, and every Canadian's going to be unique. But not enough of us are moving enough in the day, and too many of us are sitting.
Chiropractic.ca is probably the best place to go for
information. If people need more information, that's right. The Canadian Chiropractic Association, also the Ontario Chiropractic Association.
You always come on our show and you keep us healthy, make us feel better about our bodies, and we appreciate you coming in.
I'm trying.
Thanks so much, Dylan. Dr. Sasha Hamid, for being with us. Shatter is coming to the Canada Theatre, and we've got more details on that next on Daytime.